Hello everybody! Thank you for joining us for our second installment of the CRISP webinar summer series. My name is Michelle Rubin and I'll be your guide through the webinar series. This is an opportunity for you, our users, to learn about CRISP, how we can help you and your patients, and directly interact with CRISP staff. A few housekeeping items. Everyone is on mute. If you have any questions along the way, please use the chat box. We'll answer all of the questions at the end of the presentation and get to as many as possible. We may not get to all questions, so we'll consolidate all questions and answers and send them out to the group and post them on our website. This webinar is being recorded, so if you miss anything, don't fret. We'll distribute the slides, recording, and the Q&A by email and post them on our website, crisphealth.org. And also, look out for a brief survey. We would be very grateful if you filled it out so we can improve the series. So to help you understand all of the data CRISP offers to help you with safe prescribing, today's webinar topic is Fighting the Opioid Crisis, Arming Yourself with Data.
Just go through them.
Thanks, Michelle, and thanks to all of our users for joining us today. Today, we'd like to go over a few tools that we've got available to you as we fight the opioid epidemic here in the state of Maryland. So today we'll be going over our Overdose alerts, the Delegator dashboard tool, our DEA Self-Audit tool, and then we'll do a demo for you for all of those three. So a little bit of background on these three new tools. Essentially, the governor of Maryland, Governor Hogan, declared a state of emergency in March of 2017 in regards to the opioid crisis. And since then, CRISP has been partnering with state and local stakeholders, specifically the Behavioral Health Administration, to combat this opioid crisis. As part of that effort, we've been participating with the Opioid Operational Command Center to really create tools and bring together different stakeholders to support the prevention, treatment, and enforcement efforts as we combat the opioid crisis. So one of the tools or features that we've made available to our users are overdose alerts, which we'll go over. We've also made available a Delegator dashboard to help with compliance with the Prescription Drug Monitoring Program. That dashboard allows for prescriber delegators to manage their delegates. And then we've also made available a DEA Self-Audit tool, which allows for prescribers to see their own prescription patterns and their prescription history. So first we'll talk about overdose alerts. These alerts were really created to support clinical decision making. We really wanted to provide information so that prescribers have an opportunity to engage patients in a more timely manner when they find out about an overdose event, and to really be able to offer appropriate interventions where needed. Just kind of a little bit of background on how these came about and how we decided really what information to include. CRISP has put together an oversight committee of overdose alerts, and so when you see an alert, you see the content and how it's structured, where it's displayed. We've really tried to include stakeholders' feedback from prescribers, from pharmacists and others to make sure that those alerts are the most useful that they can be. So the source of overdose data comes from coded diagnoses that we get from hospitals in Maryland, DC, and West Virginia. We get those coded diagnoses either from ADT feeds, which are essentially encounter feeds that we get from hospitals, or from data that the hospitals are sending through syndromic surveillance to the Maryland Department of Health. And we've been working really closely with all three areas to really get as much information as possible. We're very, very close to having 100% of the hospitals sending data in Maryland. We've got 100% of the acute care hospitals sending that data in DC, and we're adding more and more of the West Virginia hospitals. So we're really bulking up that data as time goes by. The overdose alerts went live in March of this year, and so as time goes on, you'll start to see more and more data appear as you see those, and we are making an effort to go back and backfill as much of that data as possible. And so a little bit about what diagnoses codes are actually included. Essentially, the alerts are triggered based on ICD-10 codes that are sent to CRISP. We look at specifically 8 codes, and we're looking at when intentionality of the poisoning is accidental or undetermined. And so the way you would access these alerts is through our CRISP Unified landing page. Anybody who has access to the PDMP and clinical data would log into the Unified landing page, search for a patient, and when they go to the PDMP page, if there is an overdose alert available, they will see a bar up at the top labeled Alert Center, and if you click on the bar, it will expand out to provide one or more events that the patient had experienced. And so the content of these alerts, essentially you'll be able to see when the alert happened, where it happened, and what the coded diagnosis was. So the second tool that's available also in the Unified landing page is the Delegator dashboard. For those of you who are prescribers, historically, when you register for CRISP services, we were able to accommodate a one-to-one delegator-delegate relationship. And so one prescriber delegator could delegate to many non-prescribers, but we weren't able to have one non-prescriber delegate kind of attributed to multiple delegators. And so the Delegator dashboard allows for many-to-many relationships because we understand that one prescriber delegator may have many members of their staff checking the PDMP on their behalf. And so we really wanted to make that an option. And so the way that the Delegator dashboard works is essentially you would log into the Unified landing page, and any prescriber with a valid DEA number or pharmacist should see this tab pop up. And when you click on the tab and you begin searching in the search bar up at the top, any registered user at your organization should show up. Once you see the user that you would like to add to your delegate list, you can simply click on the green Add Delegate button, and we will confirm that you have a professional relationship with that person and you would like them to be able to query PDMP on your behalf, and then they would be able to be attributed to you, so that way when they look up PDMP, you would get credit for that query. Using this tool, you're also able to remove delegates. So if you have a staff member who perhaps no longer works at your organization, you do have the ability to remove them as your delegate. And the last tool that we'll review today is the DEA Self-Audit tool. This tool is, again, available in the Unified landing page, and it provides a listing of prescriptions that were written by a prescriber based on that prescriber's DEA number. And so, as a physician, I would be able to view and understand my own prescribing patterns. And this tool can also be used when you have any concerns about fraud. For example, if you notice that you're missing a prescription pad, you would be able to go in and see if there were any unusual prescriptions written under your DEA number. The DEA self-audit can only be run by the user to see their own history. And one of the other items of note is that the feature can only support one DEA number per user. And so when you log in, we ask for a one-time entry of your DEA number. So if you have multiple DEA numbers, for example, if you have a Suboxone DEA, you'd only be able to use the DEA number that was used when you registered for the Unified landing page. We are working on enhancing this feature to to allow for multiple DEAs, for a prescriber with multiple DEAs to be able to search their history. And so it looks very similar to the prescription drug monitoring program. Essentially what you would do is you would click on the DEA Self-Report tool. You can pick a time range that you would like to see your prescription history for. And when you click update, it'll show you a list. You'd be able to see the patient and their demographics, the date of the prescription that it was written, the DEA number for which it was written for, the medication, and then prescription information such as the fill date, any refills, and who dispensed it. All of the columns that you see here on the screen can be filtered and sorted. So if you want to see, for example, just a list of your hydrocodone prescriptions, you can set that filter and only see that. You can also sort. So if you want to see prescriptions for a patient with a certain last name, you'd be able to sort that way as well. And so we can go ahead and I'll show you a quick demo. And so as you saw, I logged into the unified landing page, and I'll go through the Delegator dashboard first. And so you would click on this page, and anybody who is already attributed to you as a delegate would show up already on your list. And if I wanted to add other delegates, I would begin typing, and then I'm able to see other people within my organization who have already registered for CRISP but are not attributed to me. And so if I would like for Delegator 1 to be attributed to me, I can click Add Delegate. I attest that we have a professional relationship and that they are allowed to access information on my behalf. And then I would click Continue. And then you would see that they would show up on your list here. If you wanted to remove a user, you would simply click Remove and attest that you wanted to remove them, and then they would be removed from your list. If you notice that a user is not showing up when you search for them in the list, it's likely because they are not registered at all with CRISP, and so we would just ask you to direct them to contact our support team, support@crisphealth.org, or self-register through our website at crisphealth.org so that they can get their usernames and passwords, their accounts set up. Once they have that set up, they should show up on your list here. And the second tool I'd like to show you is the DEA Self-Audit Report. Because this is our test page, it doesn't have any data, but as I mentioned, you'd be able to filter and sort by any of the columns here across the top. And then I'll quickly show you the overdose notifications. I'll put in our test patient here. And so once you search on the patient, you're able to choose them, and you would click on your PDMP tab. Once the PDMP tab loads, you'd be able to see this bar at the top that indicates that this patient has had a previous overdose event. If you click on the bar, it'll expand out, and you'd be able to see when the event occurred, that the patient may have experienced an overdose event at this date and time, and you'd be able to see the source along with the ICD-10 code. And so those are the 3 new tools that are really meant to help provide more information so that you can be better informed as you see patients throughout the community, and to really augment and help as we combat the opioid crisis. So I will open it up for questions now. If anybody has questions, we will try to address as many as possible, and any that we can't address today, we will certainly consolidate and send them out after the webinar. So the first question here is, does the function of CRISP depend on what browser you use? The answer is no. I do believe we tend to work best in Google Chrome, but users should not have an issue accessing CRISP using any other browser.
Sheena, I sent you another slide.
Just give us a minute. We're consolidating some of the questions for you so we can get to them. The next question is, the overdose alert that I shared shows where, and what does HID mean? So the overdose alert would be shown in the PDMP search screen, and HID, that was a test page that I had shown you. So where you saw HID, you would actually see the source or the hospital in which the event took place. So instead of HID, you might see Holy Cross Hospital or Washington Adventist Hospital, or wherever that information, wherever that event took place. The next question, will we have access to your slide presentation? Yes, after the webinar, we will consolidate all questions and make the recording and the slides along with all the Q&As in document format available for you. Number 3, do you know why Pennsylvania CRISP is not communicating with Maryland CRISP? I think PA means Pennsylvania. Each state kind of has its own health information exchange setup. We've been fortunate that we've been able to work really well with Washington, D.C. And Maryland. We're actually the designated health information exchange for those two areas. And we provide the technical infrastructure for West Virginia, which is why we're able to share that data. We do share PDMP data with Pennsylvania, and we are always working towards getting more robust information from other areas in the region. So the next question, I'm in a chronic pain clinic and we prescribe Narcan to our patients. They have started to show up as overdose alerts. Is that triggered by the Narcan prescription written? So the trigger for the overdose alerts would be a coded event that occurs in the emergency room. So if they were prescribed Narcan and used it and went to the emergency room and actually had a visit there, it may show up as an overdose alert, but I can certainly look into that to see if there's another reason why you're seeing those as alerts. The next question is, can medical assistants apply for access to be delegates? And the answer is yes. Medical assistants, front office staff, practice managers can all have access as long as they are delegated by a prescriber. And they can go to our website, crisphealth.org, complete the registration process. During that process, they will choose one initial delegator to approve their access. Once they get their initial login credentials, they will show up on a list for any other prescriber at that organization to choose them as a delegate. The next question, if you find out that your DEA has been misused, what should you do after that? Is there a reporting feature? So we really have been tasked with providing the information. I think the question here really is probably best suited for my BHA to answer. We will certainly ask what they believe the best course of action would be in that circumstance, and we'll get back to you on that one. Next question. Also, will the pharmacy report an attempt to fill a prescription which will show up on the DEA self-audit, or only those that were successfully filled? So the DEA self-audit tool will only show the prescriptions that were successfully filled. If the pharmacist suspects that there's been misuse, or any reason that they feel that they may not want to fill that prescription, they would check PDMP on their own and just not. They would take steps to either not fill the prescription or reach out to the prescriber themselves. The next question, when is the self-audit tool going to be available? I don't see it when I log in. The self-audit tool should be available in the next week or two. We were really trying to get it up and running by the July 1st PDMP mandate. We're working out all the possible foreseeable bugs, so we want to make sure it's working well when we do roll it out. It should be out very, very soon. The next question, please confirm that the new July 1st requirement to search the PDMP applies to both Maryland and DC. I am sure that Maryland is the July 1st mandate. DC, I'm not super familiar with their PDMP mandate, although if you were to search for a Maryland patient in the PDMP, you would be able to see their DC prescriptions. We can double check on that for you. The next question is this information available in DC as well? So DC is very, very similar, although they do have their own governance and structure and roll out different services based on their internal needs. We can certainly check on whether this is in their pipeline, and if there is, a need for it, or if there's a great ask, we can take it back to our team to see how we can fit that in. The next question, can certified pharmacy technicians register with CRISP in order to become delegates? So yes, pharmacists are able to delegate their access to pharmacy technicians, and it would be the same process. You would go through the registration website on crisphealth.org. So the next question, is it normal for a patient to be given Narcan when they are given a prescription for an opioid? I think that's more of probably a clinical judgment question. I know that some prescribers do. Whether it's normal or not might be a better question for either BHA or another clinical entity. Next question, can you only see controlled medications or all medications prescribed to a patient? So the prescription drug monitoring program is only going to display controlled substances, so Schedule 2 through 5 medications, and that's under the state mandate. Next question, does CRISP have connectivity with Virginia and North Carolina? CRISP does have limited connectivity with Virginia. We do get prescription information and some level of encounter information with some of the Virginia hospitals, although we are not fully integrated with them. I don't believe we are connected to North Carolina at this time, but each connection kind of goes state by state, especially with PDMP, and so I'm sure as time goes on, we will certainly move in that direction. Next question. Are we required to check the PDMP database for each scheduled drug prescription that is filled in our pharmacy, or only in suspected cases of issues? So I guess this is kind of a two-pronged question. If you are a physician, you would be required to check PDMP when you initiate a Schedule 2 through 5 medication, or a benzo or an opioid, and then every 90 days while the patient is on that course of medication. Pharmacists are required to check the PDMP when there is suspected case of misuse or any other issue. And then I'll just take one last question here. It says, I work with pathologists who have CDS licenses but do not actively or currently prescribe medications. Does the July 1st mandate to use the PDMP system apply to them? If not, will they encounter any issues with renewing their CDS license after July 1st? So the answer is yes, they should register for the PDMP. The state has incorporated the PDMP mandate into licensure renewal processes. So you will need to be registered for the PDMP when you renew your CDS license. That doesn't mean you have to use it if it's not within your scope of work, or if you don't provide the services that require a check of the PDMP, you would not be required to actually check it, but you should register. So I think that's all the questions we could take for now. I know there's a few more coming in, and we'll make sure that we consolidate and answer all of them. We will put them into a document and make sure they're available on our website, along with the slides and a recording of today's presentation. And so if you have any additional questions, you can always contact our CRISP technical support team at support@crisphealth.org, or call us directly at our phone number. And I'd just like to thank you all for joining the webinar today. Next time, CRISP's privacy and security team will talk about the importance of a good password, best practices, what phishing emails really look like, and any pieces of security information which CRISP will never ask of you. I hope you all have a great 4th of July weekend, and thanks again for joining.